Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
I saw a few healthcare providers, and so I just wanted to give some updates and get your insight. So I saw my family doctor. Like I've still been dealing with like this emptiness in my stomach, and I saw my doctor, and we tested for H. pylori, and it came back negative.
Okay.
We tested my morning cortisol, which she said came back normal. Apparently it was 335, which I think is pretty mid-range.
It is, yes. It's kind of in the middle of the range. And it was done in the morning on when you were kind of as close as possible to waking up?
Yeah, I mean, I usually wake at like 9:30, and I went at like 10:15 because I wanted to wake up at the same time and then have drive time. So I don't know if that's an okay time still.
Yeah, it is.
Mhm.
Generally speaking, the later you go in the morning, then you're going to have a decrease in cortisol because
Mhm.
you're looking for that initial spike of cortisol. But as long
Mhm.
as you're kind of going in the morning, we can kind of guesstimate. It's really the most accurate way of testing uh, is AM cortisol, which is kind of on waking, but it's hard to do that. And also, you're kind of like getting up and getting ready, and it's always a bit of an ordeal to get out and get to the lab and get
Mhm.
your hand or arm poked.
Mhm.
So that's why I personally don't love the blood testing because it doesn't really give an accurate result of what your cortisol level will be because it's kind of an artificially stimulated environment. It's also just one point. But like I shared last time, it is one way of just kind of getting an approximation of what your overall adrenal output is. So it sounds like you're not in what would be kind of determined a very, very low state that is in relation to a disease called Addison's disease. And I think when we're looking at saliva cortisol, we're looking at urinary metabolites of cortisol. Now we're looking for kind of shades of gray of a little bit more detailed and nuanced. And you can see those 4 different points that are collected on the saliva and or the urinary metabolite test.
Yeah, and I tried to make it my morning be, like, not stressful and, like, a regular morning for me, and, like, comparing it to when, we tested my morning cortisol when you had sent, like, the request for my doctor, like, 3 years ago.
Mhm.
Remember, it was 660 for my morning blood work. So I think, like, I don't know if it's, like, safe to assume, like, "Hey, maybe I don't have adrenal fatigue anymore," or at least there's progress.
Yep, having a higher cortisol means that you have a little bit more hypercortisol production. That generally is related to the opposite of what would be kind of loosely called adrenal fatigue. I've said before, I don't love that term because for most people, uh, true adrenal fatigue, first of all, doesn't describe exactly what's going on. There's a more complicated system that's happening. But Addison's disease, which is the adrenal failure, which is you're not able to actually produce enough for basic function. And this is the number one reason why family doctors and endocrinologists really don't see eye to eye when it comes to uh, the conversation around the HPA axis or the adrenal system compared to functional medicine doctors and naturopathic doctors because they're looking at it very black and white. They're not looking at it like, okay, so a person could still have adequate or okay adrenal production in the morning at the lab, but overall their adrenal system throughout the whole day, if you add it all up, is not producing enough metabolites of cortisol in general, or in total, I should say. And that's, I think, what we identified before.
Yeah. Yeah, I know, I remember you said, like, that I had inappropriately high levels of cortisol in the morning. But that doesn't seem to be the case now. So like those
Yeah,
things
so
were,
that's an improvement, it looks
yeah.
like.
And so what's leading me, so I also spoke to a psychologist,
Yeah.
and we didn't do a formal assessment for depression, but I've seen her multiple times and we talked about depression. And I requested a formal assessment, and she said, "Okay, well, like, let's just talk about it today." And she said, "Just based off of just talking with you, it doesn't sound like depression is actually a big factor for you. Like, it plays a role and, like, it's on the spectrum, and you might be like, a subclinically depressed, but it's not, like, this leading factor, and that obviously, it's not necessarily in her scope to diagnose, like, stomach problems, but in their experience, when a client is depressed or having mental health struggles and they're undereating for that reason for a long period of time or even overeating, which is what I was doing. I've been undereating for quite some time,
Mhm.
actually. The, hunger and, full cues sort of become disrupted when you go back to eating normally after having undereaten for so long. And so that's what she said, and I think, like, that kinda, like, makes the most sense, especially based off of the fact that, like, I've done these other testing.
Yeah.
I know that I have been undereating for, I mean, honestly, probably close to a year at this point. Um And finally going like, "Okay, I'm gonna start eating normally now, even though the appetite's still not really there." And now that I'm eating, like, a normal amount, increasing my carbs to, like, get a normal amount of food in me, um, those hunger cues are just not working. And so, I guess my questions are, if that's the case, which I want your opinion on, I feel like it probably is because I can't think of anything else.
Mhm.
h- I just how does that even work? Like, why? And also, what to do, what the approach is to go about getting these signals back in regulation, because I right now I'm just been trying to eat very balanced and put everything in front of me and sort of guess, okay, this is how much I should be eating to feel full. And then I also started taking a probiotic, which I actually feel like might be helping, uh,
Mhm.
because it fluctuates. It's not like an empty feeling constantly,
Mhm.
and I feel like it was getting a little bit better at one point, and then I was like, "Oh, maybe I'll just stop taking the probiotic, see what happens." And again, I mean, not again, I didn't say this, but, like, correlation does not equal causation, so it could be just a
Right.
coincidence, but it did get a little bit worse, and I was like, "Oh, maybe I should start taking it again." I bought more probiotic, and it eventually started to feel a little bit better, but now I'm taking the probiotic regularly, it's still an issue, so yeah.
Yeah, it's gonna take a while, to help your nervous system, especially those appetite centers in your brain that are regulated by some hormones, for example, ghrelin and leptin. So ghrelin's that feeling of like I'm hungry, that's what its job is, where leptin is the feeling I'm full. And
Mhm.
so if over years we've overridden that for a whole bunch of other reasons due to, for example, something as simple as I'm symptomatic, I'm tired.
Yeah, yeah. Oh, I was just gonna say, like, that was a big thing too, like, I guess I should make it clear, it's not that I was, like, so depressed that I couldn't eat, that was absolutely a role, and that may have played a leading factor for a brief period, but a lot of it was really struggling to meal prep on my own when I
Yeah.
yeah.
So for whatever the reason is, it doesn't really matter as much as the reason. It,
Mhm.
it really matters that those signals, just like any hormonal signal, can become disrupted and it needs to be kind of retrained. In the same way that the autonomic nervous system needs to be retrained, I think that this is an opportunity for you to be mindful. And so I think the signals are slowly going to come back online now that you're through that mental health challenge. It looks like the adrenal system is on the mend. It's getting a little bit better. I think definitely the reduction of that Morning cortisol does indicate that possibly. And then there are some things like probiotics, and there's even some foods that can be helpful at restarting these kind of endocrine pathways. For example, traditionally, bitter herbs, so foods that have bitter principles in them, like something like radicchio or arugula, these are vegetables that have a bit more of a bitter flavor to it. They can be helpful at stimulating ghrelin production. There are even herbal things like if you go to any traditional kind of culture, they almost all have some sort of preparatory aperitif drink, and these are made of bitter principal herbs primarily. The most well-known one is Jägermeister, which is available in most alcoholic stores that sell alcoholic beverages, but it also is full of sugar, so that's not something that would be a good idea. But the point is that there are tools in the botanical medicine world that can help us re-stimulate those hunger cues. And so if our body's forgotten to how to stimulate them or is not stimulating them at the right time, one way that we can do is probiotics have been shown to help this. And just as a bit of a digression, there's now research being done on probiotics to help stimulate this GLP-1, which is what the whole Ozempic craze is all about, and really trying to upregulate this. And this is that feeling of I'm full. And so on the flip side, herbs can do the opposite as well. So probiotics, herbs that have a bitter principles, foods that have bitter principles, and also a little bit of a technique is sometimes the sour flavor or the bitter flavor, if consumed before a meal. We haven't really done much talk about the timing of meals, but sometimes that can be a really important thing. So consuming a salad with a vinaigrette before eating your main meal is a way that it can prime the body to have a more regulated blood sugar response, and also prime some of these positive hormones that stimulate, hey, I'm ready to eat, I'm ready to consume food. So that's just one little dietary tip that you can just make sure that you're always ordering the way that you're consuming those foods in the ideal way.
Okay. Um, and this is all recorded, so I can re-listen to all that, right?
Yeah.
Okay, great. I tried to write what I could down. And you mentioned timing of meals. Is it really important to continue sort of that adrenal protocol of like eating upon like waking and like those times of days and eating something before bed, or like I follow it like I don't follow it to a T. I follow it in combination with also like how my concussion symptoms are feeling. Is that okay?
I think in your case, it sounds like you do need to train almost your endocrine system to be regular. You be regular, and on the adrenal front, you want to also train the body to be confident that you're going to be giving the nutrients at the same time all the time. So that
Mhm.
means, you know, on waking or close to waking, you're having your first meal of the day. Then you're having your second meal sometime midday on the earlier side, not waiting until 1 or 2. It's in when a person's really trying to help their endocrine and adrenal system really have optimal fueling, you don't want to have periods of fasting for very long. And this is a confusing part because generally fasting has a beneficial effect on a lot of things like inflammation. But in the one caveat case, in the case of adrenal dysfunction, where people will already know if I don't eat or if I skip a meal, all my symptoms that I'm dealing with actually get a lot worse, and I may even get more symptoms like dizziness, lightheadedness. You might get feelings of anxiety. You might get feelings of what we would consider hypoglycemia or low blood sugar. That could be irritability, just a general aggravation of symptoms. That's a key sign that we shouldn't be skipping meals. So I suggest regular, consistent feeding
Mhm.
in terms of timing.
Okay, perfect. And then last quick question about plantains. Can I eat plantains as a source of carbohydrates, or is that something that should be avoided? Because in the adrenal fatigue handout that you had given me, it says to avoid bananas.
Plantains are similar to a banana. It does, again, like a banana, it is pretty starchy. It's going to be converted into sugar pretty quickly.
Mm.
But I think in your case, we're not against having vegetables that have some sort of carbohydrate. I think that there's a role to play for those types of foods. It's more so if they're the main source of calories, like a lot of people, like I had a patient yesterday that, there was a huge component of just eating pasta with dinner or rice with dinner and then a little bit of sides. That needs the shift. So we're trying to make that a complement. So to answer your question, plantains are fine. Just make them a really small add-on, maybe a snack, or even better, add-on with some sort of protein. So you're going to get a slower glycemic absorption here.
Yeah, and like bananas, grapes, grapefruits, those things that are listed should still be avoided, like it says in the thing.
Those are just higher sugar foods or higher sugar fruits.
Mm.
Something to be mindful of not overdoing. We're trying to have almost like a 2-to-1 ratio of vegetables to fruits, but fruits still are a really great source of antioxidants and flavonoids and these really beneficial anti-inflammatory molecules. So those are okay in moderation.
Okay. Okay, thank you so much.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.